Ladies and gentlemen, please welcome Dr. Karen Fagan, PHA Board of Trustees Chair-elect and PHA Scientific Leadership Council Immediate Past Chair.
Good evening. What a great crowd. I hope everyone had a great first afternoon at conference. Before we get into our dinner and our dinner program, we'd like to take a moment to recognize someone who is serving as our Emcee this evening, Dr. Erika Berman-Rosenzweig. Dr. Berman-Rosenzweig is a professor of pediatrics and medicine and medical director of the Pulmonary Hypertension Center, a comprehensive care center at Columbia Presbyterian Medical Center in New York City. She's also a member of the Board of Trustees and is the current chair of the Scientific Leadership Council. The Scientific Leadership Council, or as we refer to it, the SLC, is a medical leadership committee that requires significant commitment of time to the PHA. SLC members proactively facilitate the development of new knowledge about pulmonary hypertension and develop educational resources for medical as well as public audiences and advocate to raise awareness about pulmonary hypertension. The SLC was formed out of the PHA's philosophy that patients and medical professionals can achieve more when they work together. For the past 2 years, Dr. Berman-Rosenzweig has served as the SLC chair, and she has prioritized building relationships with and expanding our services for the pediatric community, as well as fostering connections to other organizations and patient associations. She supported new healthcare professionals interested in pulmonary hypertension, and under her leadership, we've had the implementation of the Pulmonary Hypertension Association Registry, what we abbreviate as PHAR, which is a new component of the PH Care Centers. She's also spent time finding opportunities for PHA's involvement in the World Symposium on Pulmonary Hypertension with a special emphasis in pediatrics. On a personal note, working with Erika has been a pleasure, and she's someone whom I've learned a great deal from and will value our friendship for many years to come. Please join me in thanking Dr. Berman-Rosenzweig for her service to PHA.
Thank you to the PHA staff and leadership. What an incredible honor it has been to chair the SLC over these past 2 years, and what a privilege it is to be here with all of you tonight. So we're going to go ahead and get started enjoying your salads, your meal, because we have a very exciting evening plan that includes a dynamic presentation by PHA grant awardee, Dr. Paul Yu, a physician from Brigham and Women's Hospital, Harvard Medical School. So as the next part of the program, it's a very important part of the program, I would like to now welcome Reverend Dr. Steve White to the stage. As many of you know, Steve is a valued member of the PH community and the Pulmonary Hypertension Association. He has served as a member of the Board of Trustees for over 12 years and has served as chair of the board. He has also served on the board's governance, development, finance, and investment committees. Additionally, Steve is a great advocate for pulmonary hypertension on Capitol Hill. Blending his personal experience of losing a daughter to pulmonary hypertension and his professional experience as an Episcopal priest, he has been involved with helping PHA support groups learn about grieving and spirituality. Please welcome Steve White for our moment of remembrance.
Hello, everyone. We all know we're a community of hope, don't we? But if we're honest with ourselves, we have to acknowledge that we are also a community of loss. So let's take a moment to honor those whom we have known and loved who have lost their battle with PH, and remember them either silently or by calling out their names loudly right now. Kristen, Rachel, Megan, Candy, Matthew, Michael, Jerry. So many names, and so many more who have lost their battle with this terrible disease. So we go on now rededicating ourselves to the work that we have been given to support one another and to do all that we can to fight this wicked disease until there is a cure. And in doing this, we know that we will honor those who have been lost to PH and keep their memory alive in our hearts. We'll be back in a bit for the remainder of this program. Thank you.
Okay, let's try this again. Again, we want to thank Actelion Pharmaceuticals for their support tonight and welcome Serge Basserlian, Actelion Pharmaceuticals U.S. President. Come on up.
Thank you, everybody, for the warm welcome. My name is Serge Basserlian. I'm the new president of Actelion. It's a real pleasure to be here, and on behalf of Actelion, I wanted to welcome everybody to tonight's dinner. It's very exciting to be here with all of you. This is actually my first PHA meeting. I've joined Actelion about 6 months ago, and as anyone in a new role such as this, I've been drinking through the proverbial fire hose over the last 6 months, trying to connect with as many of you as I possibly can and learn from your experience as much as I possibly can. So it's a real thrill and a real pleasure to be here with all of you. Today has been a fantastic day for me. I've had the opportunity to connect with a number of treaters and a number of patients. One of the highlights, in fact, was I had done the Peloton Challenge, and that was a wonderful experience from the standpoint that, as I think many of you well know, as you work up and exert yourself, the idea is you work to empathize what it's like to live with PH. And for me, being new to this space, this was a very important experience to be able to connect with that experience and that reality which many of you face. So today was a real learning opportunity for me. I also wanted to say that from the standpoint of being here and building partnerships, I've had the opportunity to meet with the PHA executive, and I wanted to start off by thanking the PHA for bringing us all together as one collective community, together striving for making a difference in the lives of those with PH. So the patients, the families, the friends, the advocates, the healthcare professionals, the allied professionals, the researchers, I wanted to welcome all of you together as one tonight. You know, at Actelion, PAH is our life's work. This is who we are. This is why we come to work every day. We have a fantastic team, as I've come to know them all. You've known them all for years. The commitment that the team brings every single day is really centered all back toward the patient. It's all around the patient. It's what we're passionate about. It's what we live for. It's really why we're here. And a couple of months ago, the organization, my team, got together really for the purpose of trying to redefine who do we want to be. Since J&J acquired Actelion a year ago, it was important to define for ourselves who do we want to be and why are we here, and to remind ourselves of that. And what we settled on is this idea of resetting the achievable and reinventing what's possible, which is another way to say we are with you, joining you, working with you to make a difference in the lives of patient care, to make a difference in clinical practice, and to make a difference in terms of raising the standard of the science in this space. Since the acquisition, I'll tell you, the future, I believe, is very bright for us here. J&J as an organization is one that has very deep capabilities. Our commitment to each of you is that we continue to grow in our commitment and our investment in PH. That is our commitment. That's why we are here. And together, I believe, we will make a difference, a very meaningful difference. But I really wanted to end with recognizing the real heroes in the room. Those living with PH, their caregivers, their families, their advocates, the healthcare professionals, the allied professionals, and the researchers. Please join me in thanking and congratulating all those who've been part of the PH journey and having already made a meaningful difference in the lives of those with PH. You inspire us and you give us hope. So thank you. And I hope to connect with all of you, maybe at an intermission. Have a good dinner, please.
Thank you, Serge. Much appreciated for all the work you're doing. Everybody, enjoy the meal.